Everyone, I'm Blake Dodson, and I'm the president of Community Outreach for SmileChild, as well as one of its founders.
Hi, I'm Ava Brown, and I'm the Vice President of Community Outreach for SmileChild. SmileChild is a Columbus nonprofit that empowers caregivers by providing comprehensive education and resource connections to ensure that every baby has the chance to smile. We are fighting infant mortality using multiple approaches, including an incentive-driven, module-based smartphone application and community events. In order to make key information more accessible, SmileChild is partnering with Moms to Be, a nationwide children's hospital, to implement an educational app focusing on topics such as smoking cessation and safe sleep practices for infants. We also host community events to increase general knowledge and awareness of infant mortality in Central Ohio. With these strategies, SmileChild aims to bridge gaps in education and help prevent preventable infant death.
Tonight, we're hosting a panel to discuss COVID-19's impact on infant and maternal health. We're joined by a star-studded panel of some of the biggest players in these fields in the Columbus area. If each of you could wave as I introduce you, that would be great. Joining us tonight are Dawn Tyler Lee, Deputy Chief of Staff for External Affairs and Interim Executive Director at Celebrate One, Dr. Leith Nellen, Dean Jeffers in Chair in Neonatology and Professor of Pediatrics and Division Chief of Neonatology at University and Nationwide Children's Hospital, Dr. Chris Reber, Senior Vice Chair of Pediatrics and Associate Division Chief of Neonatology at Nationwide Children's Hospital and The Ohio State University, and Dr. Pat Gabby, Professor of Pediatrics, Obstetrician and Gynecologist at The Ohio State College of Medicine and Nationwide Children's Hospital. Thank you all for joining us this evening. We're going to start off with a section of questions discussing COVID-19 impact on prenatal care and delivery, which I will deliver to the panelists. And then after that, Ava will continue with a section of questions discussing COVID-19 and pediatric care, followed by our little wrap-up conclusion. So without further ado, let's get started. We're going to start off with Dr. Gabby. Dr. Gabby, how would you say that COVID-19 has impacted the process of attending prenatal checkups?
Well, it has complicated it. First of all, we want to make sure that the women are protected if they're going in to get a prenatal visit. And then we want to make sure our providers and our staff are protected. So there's choices that our obstetricians are making now to do some of those visits through telemedicine. So, if you start very early in your pregnancy, in the first 10 weeks or so, you're going to have 12 to 13 prenatal visits that you have to travel to the obstetrician or midwife's office. So trying to cut those down, especially in the first part of the pregnancy. And then I think second, besides the telemedicine, is if we reduce prenatal visits, then we have to be sure moms are taught how to do kick count so that they can monitor their own pregnancy and the health of that baby.
Okay, thank you. Can you go into a little bit of detail on what kick count is? I'm not completely familiar with that. So.
Well, we asked moms if from 28 weeks of gestation on to take an hour every day, same time every day, and count the number of baby kicks. So they should count 10 kicks in less than an hour. And they need to be cognizant of the strength of those kicks and how long it takes to get those kicks, and do that every day. If they feel the baby's not moving as much, the kicks are taking so much longer than that hour, then they need to call their provider. They probably should go in and be checked at labor and delivery.
So for each of these questions, I'm going to direct it to one of you, and then after who I've directed it to gives an answer. If any of you guys have anything to add, please feel free. So does anybody have anything to add to that?
I just was going to say that I think the most important thing is that women continue to get their prenatal care. And I think their healthcare providers are going to work with them to keep them safe. But really the most important thing for our moms is that they stay connected with their healthcare provider and that they really do get that prenatal care like they would otherwise, and making sure that they're staying safe.
I think some providers are sending blood pressure cuffs home with moms to take their blood pressure, especially in our population that are very high risk for hypertension. They need to be taught how to do more self-monitoring, even without COVID. These are very good practices.
And I would, Blake, just like to offer a follow-up to what Chris stated about the importance of prenatal care. And sometimes moms in our community may not know where to go for that care. And so the work of Celebrate One is only possible with the many partners we work with, Nationwide Children's, Moms to Be, and so many others. And I just want to offer for moms in our community who may be in need of prenatal care and aren't sure where to go, Step One is a tremendous resource, and Step One is a number that moms can call, and they can be screened for a number of services, but most importantly, linking them to that prenatal care. And I do have the number, it's 614-721-0009, and that early care is so critical, and we want to make sure that moms can get connected to early prenatal care as soon as they find out that they're pregnant.
That's a great addition. Thank you, Dawn. The next question is actually for you. So I was going to ask you, generally, what safety measures should expecting parents take given COVID-19?
So I would just like to offer a little bit of background about Celebrate One before I dive into that, if that's okay, for folks who might not be familiar with our initiative. But Celebrate One really was born out of the work of the Greater Infant Mortality Task Force, which was formed by now Mayor Ginther when he was City Council President back in 2014. And the work of the task force really became the foundation for Celebrate One. And our work, like others who are part of this panel, is to reduce infant mortality in our community and to cut the racial disparity in half. And so we know that African American infant mortality rates are 2.5 times higher than the infant mortality rates of other babies across our community. And we also know that some of our neighborhoods have even 3 times higher those rates, and we call those our Celebrate One neighborhoods or our opportunity neighborhoods. And so the work of Celebrate One, as I mentioned before, is really about connecting with partners all across the community to reduce those numbers and to cut the racial disparity in half. And so we really do that in 3 ways. We work to prevent sleep-related deaths, because we do believe that those are 100% preventable. We work to reduce premature births, which goes back to our earlier conversation about the importance of prenatal care. And then we work to connect the disconnected. We know that a lot of the moms and families that we serve have needs in other areas besides just healthcare, whether it's food insecurity or lack of access to transportation or stable housing or safe neighborhoods. And so we work to connect our families with those resources. So I just wanted to provide that little bit of background. And in doing so, I forgot your question. So if you could state it again, if you don't mind.
Just what safety measures should expecting parents take given COVID?
Yes, thank you for repeating that. Well, I would offer and certainly defer to the medical professionals on the panel, but I would offer that the precautions should be the same across the board. It's masks, it's social distancing, it's, staying home if you can, and avoiding, being in places with a lot of people. I remember when, before we started working remotely, and I've told this story before, and I hope I don't embarrass Dr. Gabby, but before this thing of social distancing was really resonating with me, we had a meeting, Dr. Gabby as part of our lead entities coalition, and we meet once a month, and she insisted that we have all of this space in between us at this meeting. And that was a new concept for me, but now it's, second nature. We're all practicing social distancing. We all know what it is. And so I think the rules are the same for expecting moms and their families as they are for anybody else, certainly wanting to protect themselves as much as possible, as well as their unborn child.
Taking temperature is important, and a lot of our moms need a thermometer. So I don't know how Chris and Leif feel, but I want to make sure our moms have a temperature, a thermometer, sorry. I take my temperature every day, even though I stay home. I'm not really exposed, but it's important to monitor that as well as the symptoms, coughing, and especially all the symptoms that go with COVID. So they need to be really on alert, especially pregnant women.
Next question was going to go to Dr. Nellen. Are pregnant women at an increased risk for complications from COVID-19?
So COVID is new, and it's hard to know, but there is some new data coming out that suggests that pregnant women may be at higher risk for sequelae of COVID-19. We think of COVID-19 as a respiratory disease, but it's more and more looking like it's more than that. It looks like it gets in the blood vessels and it can cause organ damage in other places. And people are worried that it might cause damage to the fetus, to the uterus. And so we don't have solid data to back up that pregnant women are at greater risk, but there is data coming out now, and I wouldn't be surprised in the next several months that data comes out that suggests that pregnant women are at high risk for COVID-19 complications. And in general, pregnant women are at higher risk for other viral infections. And so I think it shouldn't be surprising to us that they might be at higher risk for COVID-19. A pregnancy in general is a sort of a immunocompromised state anyway. So your immunity as a pregnant woman is a little bit lower than it is for everybody else. And so I do think it's really important for pregnant women, until we have better data, to really take every precaution they can to avoid COVID-19. So, doing all of those things we've already talked about, hand washing and safe distancing, wearing a mask, staying out of crowded places as much as possible. Because I do think that the data is going to show in the future that pregnant women are at higher risk for complications from COVID-19.
Pregnant women are at higher risk if they already have what we call a morbidity, or already have health issues like high blood pressure or diabetes. And so now I'm going to sound like a broken record, but that's why the prenatal care is so important, because we fear that women are so nervous about coming into their doctor and following up with these other illnesses while they're pregnant, and that's putting them at more risk because they're not being followed closely. And we do know that some of those other issues can make them at higher risk during their pregnancy, so they definitely need to see their doctor.
Thank you, Dr. Eber. I was going to ask you, I haven't asked the main question to you yet, so you're up.
Okay.
If a pregnant woman contracts COVID-19, and Dr. Nellen touched on this just a little bit, what impact could that have on the baby? Do we know yet?
Mm-hmm. So we really are still finding out all of these things. Often it takes us years to really look at our outcomes for these types of infections, and we're literally just looking at cases that happen or looking at specific hospitals. So we don't know for sure. What it appears is that maybe moms are at higher risk of delivering prematurely, but again, it's still early to be able to tell that. We don't think that the baby is infected by COVID-19 during pregnancy or during the time of delivery. We do believe that there's a risk to the baby after the baby delivers, and we can talk a little bit about what the recommendations are related to that, and what a lot of us are doing at our birth hospitals.